Okay, this video is called the Medical System Report Card, and it's based on the ratio between the benefits and the side effect provided by the doctors in these different fields. Okay, so I'm a big fan of the emergency room because what conventional medicine is best at is treatment of acute care problems. You know the cause, and you can often reverse it or at least stabilize the situation. Somebody comes in with a subcutaneous abscess, you drain the abscess. It works, okay? They come in with a fracture, you set the fracture, send them over to ortho, see if there's anything else that needs to be done. It works, okay? So lots of people I've seen have life-threatening problems, come into an emergency room and be helped a lot. Transplant surgeons, again, these are patients who quite often would be dead very soon. The transplant surgeon, in a sense, restores them to life. So that's impressive. Trauma surgeons, a lot of, real train wreck type patients do surprisingly well, especially the younger ones. But trauma surgeons, they work terrible hours. They're often total grouches, but they often really help patients a lot. Plastic surgeons, I'll give them credit. They provide the patient with what the patient wants. When I was in med school, I had considered briefly going into plastic surgery, and my father talked me out of it. He said, plastic surgeons are just prostitutes. He thought they were a bunch of lowlifes. But in a sense, they give the patient what they want. Don't get me wrong. I think a lot of these things are overrated. Breast implants, for example. You might end up giving yourself an autoimmune disease with that stuff. But they do give the patient what they want, and it's a legitimate honest agreement for the most part. Dialysis graft surgeons, putting in arm fistulas and shunt grafts, those again keep these patients alive, often for many years. So that's impressive. There's no other way to do that. Of course, it would be better to have not gone into kidney failure in the first place, perhaps with staying on the Kempner or a Kempner-like diet for a prolonged amount of time. Pathologists, they pretty much just do whatever is sent to them. They look at the cells, the cytology, histology, and they run their laboratory tests, but they're pretty good at what they do. I know a lot of pathologists. I'm friends with them. They're nice. There's not many of them that are academics. I kind of think they'd be more academics. That kind of annoys me. And it also kind of annoys me that even the ones I know, they don't have it might just be the ones I know. They're all real nice. They're good at doing their jobs, but they're not that enthusiastic about intellectual conversation. Maybe it's because I'm obnoxious, but for me, pathology is like this incredible thing. I won the award best of 333 students in my class, and I love pathology. It was like I was obsessed with it. Okay, so I almost went into it. But anyways, they do a pretty good job, but pretty straightforward. There's not a big mystery with them. Okay, urologist, the pizzle wizard, basically, they're pretty good at most of the stuff they do, putting a scope up the Johnson, removing stones. I would say they operate too much. The reason I didn't give them an A is they operate too much on prostate cancer. A lot of those prostate cancer patients don't really need a surgery, so that's why I downgraded them to B+. Maybe it should have been a B. Urologists tend to have fun personalities, though. I've worked with them a lot as an imaging-guided surgeon, interventional radiologist. I often had to work with them, and I liked them. I've always liked them. Let's see, nephrologists. Those are kidney doctors. And, actually, I probably should have given them like a C+. So the kidney doctors, they know the kidney, but they really don't know much beyond the kidney. They don't know nutrition, and I think they do screw up. They do not give patients that good of an advice. They sort of have an attitude, well, as soon as you're on dialysis, then I'll deal with you and, make money off you, send you on my dialysis machine. They really ought to be teaching these patients more of a low-protein diet to protect their kidney function for a prolonged amount of time. They should all study Walter Kempner, and I would bet you that none of them do, okay? I have some knowledge of them, and in my experience, they're nice. They know dialysis. That's sort of their turf, but they don't know much beyond that, okay? All right, pulmonologists, they're good in the ICU. They're good to run an ICU. They're good at bronchoscopy and intubating patients and helping them with the ins and outs of pulmonary disease. So that's all reasonable, but they don't know nutrition. There's no medical specialty that knows nutrition. There's not a single set of doctors trained in nutrition, epidemiology, or toxicology. Perhaps environmentalism, but I don't even know anybody in environmentalism. I knew one guy who went into something like that. They're a rare breed, and they don't work in a regular hospital, so I never see them. Interventional radiologist, imaging-guided surgeon, that's what I did. That was my first specialty, and I liked it, and I think they're very good at what they do. Why don't I give them an A? Just because I actually think they deserve an A for doing their procedures. They're good at doing technical procedures, and they get lots of experience. However, one of the reasons why I wanted to get out of it eventually was because they're sort of like an order taker. They don't tend to drive the show. They tend to get requests to do stuff, a request to embolize a hepatocellular carcinoma, cancer of the liver, a request to declot a dialysis graft, a request to, form a balloon angioplasty in a superior vena cava. So they're sort of very, very, very sophisticated technologists, but they're not doing that much running the show of complex medical thinking. And I got bored with that. I'm always having to take orders. Do this, do this, do this. I wanted to run the show a little bit more in some way. Okay, dermatology, scrape skin and give steroids. My father also talked me out of going to dermatology. He says dermatology is for idiots. It's, any idiot can do dermatology. Don't waste your brain with that. But, they're very popular. Women like dermatologists. If you're a guy, you go to dermatology, you always got a bunch of women around you asking you questions. Did seem like it would be quite boring. I remember one of them gave us a lecture, and he joked about leaving his stethoscope in the closet. He never has to use it, so we all kind of thought that was neat. But, again, they don't teach anybody about nutrition or any of this other stuff. And really, if you're going to be healthy long term, you need to know something about nutrition. And that's kind of like my joke about conventional medicine. You walk into a conventional hospital, you see all these fat secretaries and fat nurses and fat doctors who can't even take care of themselves. So how are they going to provide good general health advice? And every part of your body is dependent on your diet and your avoidance of toxicology. And the benefit of knowing epidemiology is it makes everything more convincing. All right, so because they don't know that and they don't really know toxicology too well, if you go on the YouTube, you see tons of dermatology YouTube channels, and you'll hear them talk about, the pluses and minuses of all kinds of skin creams and all this stuff, but you don't hear them talking that much about the side effects and the toxic chemicals inside those creams. So they're kind of woefully ignorant on those subjects. Orthopedic surgery, the old joke was, orthopedic surgeons are stupid, bone broke must fix, but, I always liked them. I consider going to ortho because they tend to be relatively athletic guys. I was a college athlete, and they're just fun. If you're on general surgery, you really can't joke around because there's like all these patients crashing and burning in the intensive care unit, and it would be like inappropriate to joke around. Whereas in ortho, if there's a medical problem with the patient, they just turf that to internal medicine. So they just focus on, open reduction, internal fixation of femur fracture. They don't care about the medical stuff. So they're fun. They're always joking around. I liked hanging around with them. I just thought orthopedics was so intellectually dull. I mean, you spend conference after conference memorizing all these fractures. These are the 10 types of fractures that occur in the wrist. These are the 10 types of fractures that occur at the elbow. I thought it was so boring. I almost couldn't take it. And I knew that my skill was I had a phenomenal memory and ability to learn complex things. So I'm like, I would be a waste in ortho. All my brain power abilities would be kind of wasted. So I didn't go into it. And of course, they operate too much. Every surgical field probably does more surgery than it needs to. And some of their knee surgeries in particular are kind of overrated. A lot of spine surgery is overrated. A lot of that comes from neurosurgery as well. But overall, they're pretty good. They do a pretty good job of what's their job to do. And again, I would try to avoid getting a joint replacement if I could, but if you have to get one, good orthopod can do a good job. PMMR, pretty good. They take care of the old stroke patients, and more of them are starting to get into pain management. They don't tend to innovate too much, and they don't know nutrition, but they're pretty decent at what they do. Radiology, I give it a B minus. Why do I give radiology a B minus? Well, I think radiologists, there's a lot of real smart radiologists. At the time I went into it, you had to be in the top 15% of your class to have a hope of getting into it. But I think, what I like about them is, they're great with high tech. They've made a lot of innovations. As the computer age has improved, so have all the radiology machines, and they can show incredible things. You can do a CT angiogram of the head and the neck real fast and get beautiful pictures almost as good as a catheter arteriogram. But why do I give them a B minus instead of an A? Just because I think they were too eager to hop on the bandwagon with this screening stuff. So they do a lot of imaging that's really, in my opinion, probably not necessary. Like mammography is totally overrated, but they're never going to talk about it because they're making money off it. They make a lot of money off mammography and some of these other CT screening things for lung cancer. I think it's pretty overrated. And CT for coronary artery calcifications. Anybody who's eating the SAD diet is going to have coronary artery calcifications. You don't need a CT to know that. But so what I'm saying is, they're amoral. And on one hand, being amoral, I maybe kind of like it because, and that's partly the reason I went into radiology, because I knew I had a phenomenal memory and I'd be able to memorize everything. I was done with my boards in less than a third of the time with a perfect score. So I knew that was my skill. But I sort of, and it's amoral. Radiologist doesn't decide if the patient goes for chemo or not. So they don't have to make those types of decisions too much. And they can learn a lot, so that's all good. But they did weasel out on, they'll let the increased imaging volume, screening, and all this stuff go because they're making money off it. Infertility specialists, a lot of them really don't know what they're talking about too much. They got all their procedures, for harvesting the ovaries and in vitro fertilization, but they don't know and they don't teach the patients all the things they should teach them about avoiding estrogenic chemicals or other things that cause infertility. So they kind of half-ass on that. And again, that's a general theme through much of conventional medicine is doing what pays you for money and then not educating the patients to empower them and help them. And it's partly because the doctors don't know, but it's also part of the system. I got lots of doctors who know me and compliment me about all my knowledge and stuff, but not a single one of them would ever invite me to speak in front of their groups because they know, if I'm talking about diet and toxicology, that's not going to make any money for the groups, and whoever runs their group wants money. So why would they bring in somebody who's talking about stuff that doesn't make them money and they don't get paid for teaching the patient this stuff? So what I'm trying to say is the ethics are weak, and it's for, most of conventional medicine. Ophthalmology, same thing. They do all the stuff they make money for. They're good at, giving you a pair of glasses, and they are good at a lot of their eye surgeries. And I've worked with some ophthalmologists I've been impressed by them. I like them. They're smart. They're nice. But they certainly don't know anything about nutrition, and they don't teach it to the patient. And again, it's probably not their fault, a lot of them. I know a lot of them who are fat, okay? So they can't even fix their own hypertension and diabetes. But that's what tons of their patients have. Atherosclerosis, hypertension, diabetes, and obesity. And so they're not really able to help their patients with that. They'll do all their fancy, zap the abnormal blood vessel rather than teach the patient how to not have that vessel. Anesthesiology, in the OR, they know how to sedate the patient and wake them up, but I wonder how about some of those drugs that wipe out your consciousness if they're not also wiping out your memory. And, you never hear anybody talking about that. I've had some patients come to me with previous surgeries and they've had memory problems since their anesthesia. So that kind of scares me. That's another reason why I don't want any type of surgery. The average patient's like really stupid. Whenever they come for procedures, like, oh, I want to be knocked out. And it's like, no, you don't, okay? Whenever you can get a procedure done with local, do it with local, okay? Like I said, I had to go for colonoscopy once, and I don't need to go back because I know my risk is so low, but I refuse to be sedated. I don't want those drugs, those, benzodiazepines, Versed, are going to affect my memory. No way. Family practice, I give them a C+, kind of for the same reasons as internal medicine. I give you internal medicine a C-, just because they do a bit of a wider variety of stuff. Internal medicine is mostly dealing with adults with chronic problems, obesity, diabetes, hypertension, atherosclerosis, and I know lots of internal medicines and I like them, and some of them are real smart. I'm friends with them. But they don't learn it in school. They don't learn it in resident nutrition, epidemiology, toxicology. And I've talked to them. My internal medicine doctor friends will tell me, yeah, Pete, I got to learn more about your nutrition stuff. They said, our drugs, they just don't work. They don't work. These pills are poisons, and it's like, what are we supposed to do? And, they make their money from following the standard of care. All doctors do. You follow the standard of care and you get paid and you can't get sued because it doesn't really matter what the outcome is as long as you follow the standard of care. So that's why everybody does it, and you get paid for it. It is fast, okay? To talk to a person and educate them, that takes a lot of time and you don't get paid for it. So you can't do that because you're always under pressure that there's always going to be a bean counter who runs everything in medicine. And the bean counter, for whatever the field, is going to say, you didn't generate as many beans today as the other doctors in the clinic, as many billing codes. Therefore, you're going to have to, start working harder or we're going to have to let you go, okay? So all docs are forced to do what the insurance companies want, what the bean counters want, and there's no way around that if you want to keep working in medicine. Okay, general neurologists, the same story. They're pretty knowledgeable. They're real nice. I'm friends with them. I like neurologists. I talk to neurologists every day. But, they haven't learned. I'll give neurologists credit for. They do want to learn. Neurologists do want to learn. It's not their fault. Their textbooks suck. Okay, I own 1,700-page Ivy League textbooks of neurology, and they're an absolute joke, okay? Here's a book, 1,700 pages, dedicated to the brain, and there's only 2 paragraphs on excitotoxicity. Okay, that's stupid. That's embarrassingly stupid. And when they write about dementia, they emphasize Alzheimer's. Just stupid. So basically, they're conformist and stupid. They're textbooks, and I can tell you, they suck, okay? Things like when a patient has a stroke, they not only get breakdown of the blood-brain barrier, they get breakdown of the gut barrier. They get increased intestinal permeability, leak of gut. And it's important that they don't feed the patient stuff to worsen the situation. But none of them are aware of this. Same thing with traumatic brain injury. Anything that opens up the blood-brain barrier tends to open up the gut barrier. And they just don't know any of these things. They're not familiar with voltage-gated channels and the effect of, cell phones on them. They don't know this stuff, okay? And some of them, I actually teach them about these things, but it's just not on their radar. They're very good with, of course, the pharmacology and neurology, and they know all the diseases pretty well, and they counsel the patient. But what I'm saying is they could do better, okay? Vascular surgeons, they're great at, tying in a vascular graft. They have meticulous technique to do a bypass. But, I spent a lot of time around vascular surgeons. I did a surgical internship, and because I was a vascular interventional radiologist doing angioplasties and thrombolysis, I talked to vascular surgeons all the time. I never once heard a single one of them know anything about nutrition, okay? So technically, they're highly skilled, and they're some of the best surgeons in the whole business in terms of technical skill. It takes a lot of skill to make a small anastomosis distally in the leg, for example. But, they don't even know their own disease, atherosclerosis, which they stare at every day, okay? It kind of reminds me of endocrinologists. I gave endocrinologists a D because I tried to meet with some of the best endocrinologists you could. I got referred by different doctors and nurses who are the best endocrinologists, and I went and met with some of these doctors, okay? And not a single one of them had read any of the papers about diabetes. I'm not kidding you. All they knew was all the drugs. They knew all the drugs used to treat diabetes. They knew all the blood tests, so that kind of thing. But they hadn't read the basic papers. Sweeney, Himsworth, Rabinowitz, Shellman, okay? Brownlee, basic freaking stuff. The foundation of what's known about diabetes, they didn't even know it in their own field. And so what I'm laughing is all doctors take their boards, which is based on reading the textbooks in their field. And the textbooks in all these fields, they don't include the important stuff, so the doctors don't learn it. And once they're done with residency, they want to make partner. They usually have delayed their family, so they want to have some children, get married and have kids. They're exhausted with the new kid in the house, and then they're trying to make partners, so they work all the lousy hours and shifts. And then for CME, they've neglected their spouse because they're working so much trying to make partner. So to make it up to their spouse, they take them on vacation to go to continuing medical education course. They just sign the attendance in the morning and go to the beach, okay? They don't even listen to the lectures quite often. Or if they go to the lectures, it's a joke, okay? There's most of these CME lectures, they just repeat the stuff that you got lectured about in residency. They stink. And the only reason people go to them is because you're required to go to them. They stink, okay? And none of these CME places will invite somebody like me to talk because they don't want me talking about controversial stuff, okay? So it's basically a joke, and everybody knows it's a joke. Let's see, what else? OB-GYN, they give such bad advice to pregnant women. Really, they betray the pregnant patient, and that's what pisses me off. And that's what I give most of these bad grades are for, because I believe that many of the doctors in these categories, they have violated their oath to the patient. They have put the insurance companies so far and the money so far above the patient. Part of it's they can't help because they're ignoramuses. They don't know nutrition, epidemiology, and toxicology. But, you might screw up 10, 20, 30 times, but when you screw up 500 times, it's about time you learn something. You should know by then. They've seen so many shitty outcomes, excuse my language, but, once you've seen all these kids messed up, all these women messed up, you start saying, well, why don't we learn something? Like, let's say a woman with breast cancer. Yeah, you might, the first couple of them get tortured with mastectomies. You could say, well, gee, now we know we don't need to do that anymore. And now we learned all this other stuff about estrogen chemistry. I've never in my whole life met a single doctor that knows estrogen chemistry. Whenever I teach a resident or a medical student that comes around me for a little while, I go, what about this? What about this? They never know anything. And that's so easy. Like I said, any health coach could watch videos at my YouTube channel for 1 week, and they would know far more about what causes diseases and how to avoid diseases than any of these doctors, okay? So that's why, it's kind of a joke, okay? You go to pre-med for 4 years, you go to med school for 4 years, you do a residency. The shortest residency is 3 years. The longer ones with fellowships are 7 years. And so after all these years, and they still don't know what causes the common diseases and how to treat them and avoid them and prevent them, but they could learn this in just a week of watching internet videos. That's why, You have to ask yourself, is conventional medicine illegitimate for the most part for all these chronic diseases? They define stuff as chronic because that means that they can't cure it, they can't treat it. But most of these so-called chronic diseases are not really chronic. They're often routinely cured. Obesity cured with low-fat vegan diet. Hypertension usually cured. Type 2 diabetes usually cured. I mean, once it's been real chronic and they lost pancreatic function, it's no longer going to be curable. Once the hypertension has gotten so bad and all the vessels are calcified, it's going to be harder to fully reverse it. But I think the point is made. Okay, what else? These are all kind of the same thing, like gastroenterology. Yeah, they're good at doing their colonoscopy, but they don't know anything about nutrition. I know some doctors that are excellent technically at doing their colonoscopies, and they know their colon cancer and esophageal cancer, all that stuff backwards and forward. They're great with their scopes. Okay, but they don't know nutrition. The average one you'll talk to, I know some that are best of the best technically, but they don't know the basics of nutrition. If you ask one of them, they'll typically say, oh, I've heard the Mediterranean diet is good, which is completely stupid. And that's their field, the intestinal tract, okay? Like I said, endocrinology and diabetology. I hate the diabetologists even worse grade because they don't even know what they're talking about. It's an embarrassment, okay? The whole diabetic diet, American Diabetic Association diet, it's just, it's bad for the patient. This is a disgrace. The patient would be better off not knowing them for the most part. If they just, went on the internet, low-fat vegan diet, cure themselves rather than all this nonsense, take all these stupid pills that don't work. Metformin's a mitochondrial inhibitor, and some people think that's a good drug. I've had a bunch of doctors asking me if they should take it for longevity. I'm like, are you stupid? I'm taking a mitochondrial inhibitor for longevity. Are you a moron? That's associated with it. I won't even get into all the things associated, but it's completely stupid. Okay, cardiology, same thing. Any cardiologist with a brain sees all these patients with coronary artery disease. It's pretty easy for them to open up a book and learn about, Armstrong, Ornish, Kempner, Pritikin, Esselstyn, etc., etc. It's obvious, okay? But you go on the internet, you'll see all these cardiologists promoting the ketogenic diet, telling people to eat olive oil or omega-3s. It's ridiculous. That's complete BS. They should be ashamed of themselves, okay? And at VegSource, Jeff Nelson's made some videos about all this stuff. And I know why these cardiologists get tricked into thinking things are good, like this olive oil and omega-3s. The industry-funded research just compares it to some type of straw man. They'll compare it to, a real meat-based diet, whatever. And so it makes the olive oil look good. It makes the omega-3 look good. But when you look at the studies more extensively, omega-3 and olive oil are for chumps. I wouldn't take those. The only context I would take omega-3s is if I had a autoimmune disease that was not reversible by changing diet, avoiding toxins. Then I would take them. I would take those before I would take those real powerful anti-immune system drugs, things like methotrexate. Those drugs are almost like chemotherapy. So I think the rheumatologists are other ones kind of reminding me like a cardiologist. How could you be in that field and not know leaky gut? If you read the chapter in the big pathology textbooks, the Harvard pathology textbook, again, like 1,800 pages, big ass book, okay, there will be nothing about leaky gut in the rheumatology chapter. That's why I'm saying is conventional medicine illegitimate? Okay, the coronary artery disease chapters won't ever mention low-fat vegan diet, nor in the hypertension section. Pretty much every chapter about chronic disease in a conventional medicine book will say the same thing. No one knows what causes it. It's associated with aging. It appears to be partly genetic. Standard treatment recommendations are take these medicines, hopefully slow it down. Once the patient progresses, as they are expected to do, eventually surgery becomes the treatment of choice. Okay, it's stupid, okay? Be just as well off back in the 1700s getting a therapeutic phlebotomy, okay? It's just stupid. Okay, infectious disease, they obviously say a lot of stupid stuff. They obviously sell out the patients and do not do what is right for the patients, and they should be ashamed of themselves. And, they don't know the basics, okay? I've been shocked. I'll talk to some of these infectious disease. And by the way, I like them. They're nice people. I'll see them, and I know they mean well, and they'll ask me to follow up with them. They'll ask me questions about, how to interpret a spine MRI for spinal infection. So I respect that. And I know they try in that sense. But they really ought to open up a book and read about things like dormant bacteria, about leaky gut, about gram-negative, gram-positive bacterial endotoxins, about amyloidogenic clotting, about iron overload and ferrous redox cycling. Basically, why is it that I can go into any of these fields and know the literature of the field better than the doctors who specialized in it and did 3-year fellowships in it? Okay. That's embarrassing. They should be embarrassed. And I know why, because they only read their textbooks to pass their boards, and they haven't opened, haven't been reading the scientific papers in their field. So they don't even know the papers in their own field. Okay. And a lot of patients suffer because of that. Okay. And I think all doctors, as a field, tend to sell out their patients in the sense that you can't get in trouble and you make your money if you practice standard of care. But if you put yourself, in the patient's shoes and you say, gee, how can I empower this person to help themselves? That is strongly frowned on by conventional medicine. You won't get paid for it, and if you do it more than just here and there a little bit, you'll end up getting in trouble because you won't be able to keep up on your generating your billing codes. When a doctor has to work their butt off, they work their butts off. And doctors have to work harder than other people in a hospital. Okay, I realize there might be some exceptions to that, but let me explain what I'm talking about. If, let's say, I'm not even going to say the field, but let's say you're a technical person in a hospital, you'll be given a work shift, let's say from 8 o'clock to 4 o'clock, okay? Or you'll be expected to work from that time. It's not like that with a doctor. A doctor can be, on paper, have a work shift from 8 o'clock to 4 o'clock, but they don't go home until all the work is done. Every single thing is done. And so very often that so-called 8 to 4 o'clock shift could be, 7 o'clock in the morning till 6 o'clock at night. And that starts becoming a pretty long day. So tons of doctors are workaholics and exhausted all the time. And if they don't do that, the clinic will say, well, so-and-so does that much work. And so we got other people applying for this job. If you don't want to do the work, there's the door. Goodbye. And no one really cares about them because the individual is actually not that important unless they're a rainmaker. They bring patients to the clinic because no one follows the outcomes. So let's say you had two doctors and one of them was just great at curing the patients. They cured patient after patient. Well, and then another doctor had really lousy outcomes. Which one do you think would be preferred by the clinic? The bad doctor is better for the clinic because the bad doctor, the patients never get better. So they keep coming back. You keep on making money out of them. If another doctor was talking to the patients and curing them and sending them on their way and they don't need the healthcare system anymore, the hospital will be losing money because he cured the patient, losing money because he was talking to them too much rather than generating more billing codes. So they would tell the good doctor, take a hike, get the hell out of here, don't let the door hit you on the way out. So that's bad. I mean, don't you see what I'm saying here? In conventional medicine, the doctor who cures the patient is considered a failure, a screw up, and gets fired. Whereas the one who has the worst outcomes, like during my internship, there was an internal medicine doctor who did almost no work, and he would just get consults for everything. And all the internal medicine residents from the local university, they hated this doctor. This guy, they said he's the worst doctor. He's malpractice. He's a piece of crap. We don't want to rotate with him. We don't learn anything with him. They hated him. Well, guess what? This guy was one of the highest ranking doctors amongst the medical staff at that hospital. And the reason was he brought tons of money to the hospital. And all the specialty services loved him because he sent them all these consults. So what I'm trying to say is you have a screwed up system when the worse the doctor is, the more money they make and the more popular they are with their hospital management system. Okay, so the more you mistreat the patient, the more money you make. Does that make sense? And that's a messed up system. And it could never be good. The only thing that could save medicine, there's like two things that could save medicine, and neither one will ever happen because they'll cause a loss of money. Number one, if you followed outcomes. No one tracks outcomes. You'll almost never hear of anybody tracking outcomes because if you tracked outcomes, let's say for hypertension, coronary artery disease, it would become obvious that low-fat vegan was the best treatment and they would lose money. So they're never, ever going to track outcomes because they don't want anyone to know that there's another way to do things than prescribe a ton of drugs and do a ton of surgery. So that can't be done. The second thing, the way you can make medicine get better, is if you had Christian ethics. That, man is created in the image of God, therefore part divine as well as part beast, therefore should be treated as something special. As Ayn Rand had said, the smallest minority is the individual. So if you greatly value the individual beyond money, you have to value them more than money because there's big money involved here. If you have coronary artery disease, you put them on a pill, you get money out of them every day for life. You milk them like a cow. You put a stent in, $30,000. You do open heart surgery, you can make $120,000, $150,000. You teach them the vegan diet, you either get nothing or you can maybe make $1,000 off them. You have them come in for a weekend course. So you can see you have to have incredible like religious ethics, otherwise you cannot do this stuff. You got these big fancy hospitals are like the modern equivalent of a cathedral, okay? And so how are they making money? Mostly by selling patients drugs that don't work, and look at all the drugs they give to children. They essentially poison them. So it's sad, but it's true. You make a lot more money selling patients poisonous drugs that don't work than you do talking to them and helping them. And unless you have Christian ethics or you follow outcomes, this could never be fixed. And that's why all this, oh, our hospital's so great. Yeah, right. They're all Western hospitals are really pretty mediocre compared to what they could be. The fastest way to improve outcomes in every single Western hospital in the entire world would be this low-fat, low-sodium, vegan diet stuff. Okay, and then tracking outcomes, and all the doctors will become self-educated if they track their outcomes because they go, holy crap, the vegan diet works, this other stuff don't work. But it could never happen, and it'll never be allowed to happen because it would go against the profits. And the profits are controlled by the big money players, of course. They're never going to allow that to happen. Okay, what other specialties do I think are kind of a joke? Like cardiothoracic surgery. They're great at putting in a valve, and that can save a patient's life. But for coronary artery disease on a chronic basis, it doesn't really work well. But that'll never change because they make tons of money. They used to be like some of the richest doctors in the whole field. I actually thought about going into it once when I was younger. I didn't know any better. Multiple sclerosis specialists. Yeah, they kind of annoy me because they've got something great like, the swank diet and all this stuff, but instead they put them on all these drugs that don't really work and cost tons of money, and MS patients have terrible outcomes, and I've seen some really bad things in multiple sclerosis, and I've seen, wealthy, educated people with just terrible outcomes from those drugs. So, and then I look at swank with incredibly good outcomes, and I'm like, well, why isn't this done? And I've talked to a bunch of MS doctors, and they always sort of laugh off the diet stuff. And if you look at the MS doctors on the internet, they laugh off the diet stuff. And I'm like, you guys have terrible outcomes. You have something here that's shown good outcomes for good reason. Why wouldn't you try it? And they won't try it because there's no money in it. Pediatrics in general, yeah, they sell out their patients, man. They do so many things to these kids that are terrible. They're a disgrace, okay? A good doctor should be the ally of the patient. And I told you, that's one of the reasons why I like that Kelly Brogan psychiatrist, okay? Because she's on the patient's side. A good doctor says, I value the patient and I am loyal to them above these insurance companies, above these bean counters at the clinics, above whatever, Ivy League BS artist is lying and publishing papers that aren't true. They'll fight for the patient, okay? And believe me, that's a rare thing that a doctor will fight for the patient above the system because there's no money in that, and the doctor can get in big trouble real fast. They don't prescribe the standard of care. The patient has a bad outcome. The patient could sue them, and they will lose because they didn't practice the standard of care. But a lot of times the standard of care is a disgrace. It doesn't work. It hurts the patient. And that's why I'm saying is a lot of doctors, in a sense, they're obligated to hurt the patient because that's how they make their money and that's how they stay out of trouble. And that's a messed up system when you're rewarded for hurting the patient. And I can tell you, it's incredibly common. It's incredibly common that that's what happens in modern conventional medicine. And that's why I say modern conventional medicine overall is a disgrace. And many of these fields would be better off going back to the 1700s, or if the doctors didn't even exist, because then the patient wouldn't be lulled into all their BS, okay? And psychiatry is a terrible field, okay? Don't get me wrong. My father was a psychiatrist. He's a good guy. He did the best he could. But the public also sort of thinks doctors are so smart. The average doctor has an IQ of about 120. They're very hardworking. You have to be hardworking. You can't make it through medical school and residency. But a lot of them, they're not that smart, okay? They don't read anything on their own. They never, ever challenge conventional thought. And you will say, well, why is that? I'm like, well, they're selected to be conformist. They're rewarded for being conformist. Why would they be outspoken or contrarian? There is no money in that. There's no reward in it. The whole medical system is very hierarchical. You always, in a sense, have to, salute the rank above you, if you will, to continue and get your letters of recommendation, get your ticket checked and everything. So the, sort of iconoclastic persons like myself or something, we'd always be getting in trouble. Even when I was in medical school and residency, I often got in trouble for stupid stuff. Things like they would tell me, oh, you have to give your lecture on some boring topic. I go, no, I'm going to give my lecture on what I want to give it on. I always knew I was great, so I routinely just ignored them. There would be times in my rotations I would get bad evaluations or other things because, like in my pediatrics rotation when surgery, I just refused to do what they wanted me to. Because, for example, the other docs didn't want to do spinal taps, so I took all their procedures. I wanted to do all the spinal taps. I wanted to present on meningitis, become an expert on that, so I would present on that, and I refused to present all the topics that they wanted me to. They would just want me to present on whatever they were interested in, having no care for what was good for my training and development. So anyways, that was my experience in pediatrics. And in psychiatry, what I'm getting at was they don't really know what happens with these drugs. They just, whatever the Ivy League doctors say, and the Ivy League doctors do whatever pharma says because they get their grant money from pharma. And so, like, they poison these children and these adults too. These psychiatric drugs are just basically a chemical lobotomy, almost all of them. And you almost never see a psychiatrist say, look, I'm going to do what's right for the patient. And that's why I love Bragan. That's why I love Brogan. That's why I like Moncrief and some of these other ones, because they're standing up for the patients. Whereas the system basically says, look, if we poison the patient with these drugs that don't work and cause a chemical lobotomy, we make tons of money. Okay? And to do that to kids is so absolutely ridiculous. So I think it's a disgrace. I think their behavior, their conduct is a disgrace. They've betrayed their patients, and that's why I joked that for a lot of fields, I think conventional medicine is really almost illegitimate. It should be like about the last choice. You know, as Bragan said, it's a very dangerous thing to go to a psychiatrist because they're probably going to put you on a drug, and that drug is probably going to be toxic to your brain. And the longer you're on it, the more likely you're going to end up cognitively impaired. So, anyways, for what it's worth, I've just sort of sharing what I think of these different fields, and I hope that was interesting or helpful.